Let's talk about the different types of depression, right? So the one of the ones you hear about most, you see commercials about all the time is major depressive disorder, right? And that's the most common one that's talked about. I think it's the one that's most, diagnosed, right? So this is one that's typically, diagnosed if you've had these symptoms of major depressive disorder for more than 2 weeks. You'll typically get diagnosed, and the symptoms, are typically, irritability, lack of sleep, uh, thoughts of hopelessness, feelings of hopelessness, thoughts of suicide. Um, there's a whole host of symptoms. So that's typically with major depressive disorder. There's a seasonal affective disorder, which is really common in northern states, especially New York and Western New York. Is as the winter season comes on, the days get shorter. I think Seattle is a really high concentration of seasonal affective disorder. Alaska is big. I think they actually pay therapists more to move there. So um, seasonal affective disorder, major depressive disorder. There's postpartum depression. A lot of women deal with that, and I frankly believe a lot of women don't get a lot of help around it after giving birth. They'll see a doctor, a nurse, but they won't get checked in with weeks or months after the baby's born. And there's also a persistent depressive disorder, and this one is more of a lower grade depression, but you have to have it for more than 2 years. So it's still depression, and it's still not good, and it doesn't feel good, but it's more of a persistent depression as opposed to just a hard hitting, like major depression. It's just like a persistent gloom, and there's, many people out there that have that too. So those are some of the major forms of depression that people can typically struggle with.